Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're talking all about pulmonary edema. So let's get into it. So first of all, what is it, right? It's an abnormal accumulation of fluid in the interstitial spaces and the alveoli of the lungs. And potential causes all have to do with fluid overload. So anything that can cause fluid overload could potentially be the cause of this. So some examples of that are like kidney failure. A lot of times pulmonary edema is a complication of a cardiac thing, so a complication of like heart failure, or maybe somebody's just had a heart attack, that kind of thing. This is a medical emergency, okay? So if your patient has this, they need to seek medical treatment right away. And then who's at risk? Pretty much anybody that has anything that can cause fluid overload, right? So somebody who's just had an acute MI, they're septic, maybe with a hypertensive disorder or like a heart disease, somebody with left-sided heart failure or a drug overdose, trauma, especially to like the chest wall. And then the special one, we'll talk about this a little bit more at the end, high altitudes and deep sea diving. So if you are somebody that does not live at a high altitude and then you go somewhere that's a high altitude and your body's not used to it, okay, that's a risk. Or if you're somebody that participates in deep sea diving as like an activity or a hobby, that also puts you at risk. So now that we've defined it and talked about this stuff, let's talk about the signs and symptoms. Now let's talk about the signs and symptoms. The classic sign, the big one that everyone's looking for with these people, is having this cough that produces like a frothy, blood-tinged looking sputum. Okay, so like that's the classic sign you look for on these people. Other things you might notice, difficulty breathing, wheezing, JVD, they could become pale or cyanotic, tachycardic. They could be apprehensive or full of anxiety, which makes sense because if you're having a hard time breathing, right, you're coughing up all of this stuff, you feel almost like you're being suffocated, of course you're going to have these sorts of feelings. You're going to feel apprehensive. You're going to have that like feeling of doom, like something bad is happening to you. Because remember, this is a medical emergency, right? So a lot of these signs and symptoms are related to somebody having a medical emergency, right? So now that we know that, what are some diagnostic tests that we can do for it? If you come in with those signs and symptoms, probably the very first thing they're going to do is a chest x-ray, okay? So they'll do a chest x-ray and they can use that to diagnose you with the pulmonary edema or to rule out other things. That's why they're doing it, okay? Because having respiratory symptoms like that could be a lot of things, right? So the chest x-ray is going to help them confirm that diagnosis and rule out other things. They can also do ABGs. They can do a BMP. You might get an EKG or an echo. Now these are really more associated with like cardiac things, right? Heart failure things. But remember at the beginning of the video I said it's usually a complication of heart failure or a heart attack, right? Pulmonary edema is commonly a complication of those things. So it would make sense that we would be doing cardiac tests, right? And cardiac labs on these patients. And then sometimes they might also want to do an ultrasound of the lungs. What is the nurse's role in taking care of these patients? So we're going to do vitals frequently, like every 15 minutes until they're stable. They're going to be on strict I&O, and actually we're going to restrict fluid. And that kind of makes sense, right? Because they have fluid overload as a problem. We're going to monitor their ABGs and their serum electrolytes. Maintain a patent airway and possibly suction. Now remember we talked about that classic sign being the cough that produces like the frothy sputum. So they are likely going to need that suctioned. So suctioning would be a big thing that you do. Put them in the high Fowler's position with their legs dangling. A high flow rebreather mask or potentially BiPAP, or even potentially a vent, okay? So it's really going to depend on how they are, but oxygenation, that's the big thing, right? They need oxygenation. Fluid restriction, we talked about that. They're going to be weighed, so we got to keep an eye on their weight because people with fluid overload, they can gain, 5 pounds in a day, okay, in just a couple of hours. Things like that, so we want to keep an eye on that. Administer meds as ordered. Some common meds you might give would include Lasix, morphine, and antihypertensives. Of course, we're going to do very, very thorough head to toes on these patients, right? And we're going to do them a lot more frequently than we would, not just like once a shift kind of thing. We're going to be doing these a lot more frequently, especially if they're not stable. And then just overall, be supportive. Remember we talked about how they're like apprehensive and anxious and this is really scary, right? They're having a hard time breathing. So being really supportive and trying to keep them calm is really going to be important too. All this other stuff, this like medical stuff, yes, of course, it's very, very important. But remember, nursing is a science and an art. So you got to do the science stuff, but you also have to do, the people skills stuff, right? Being supportive, trying to calm them down and being a support system for them during this, really scary thing that's happening to them. So the last thing I wanted to talk about in this video is that high altitude thing, right? I talked about this at the beginning and I said it's kind of special and we'll talk about it at the end. Okay, let's talk about it now. Let's talk about high altitude pulmonary edema because this one's a little bit special, right? So this one has nothing to do with heart failure or kidney failure, anything like that, okay? So the idea of this is at high altitudes, the blood vessels in the lungs constrict and then they start to leak fluid, which eventually ends up in the alveoli, okay? So that's kind of the idea behind this. So healthy people, so we're talking healthy people, not, people with heart failure. Healthy people will adapt to the hypoxia because as you go up higher, 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 the air becomes thinner and less oxygenated, right? So healthy people will adapt to the hypoxia depending on the rate of their ascent. So how high are they going at what rate, right? The severity, so how low is the oxygen level where they're at. And then the duration, so how long are they exposed to that low oxygen level. And then there is a genetic component. So some people, they can, get affected by this pretty quickly, whereas other people, they handle it really well and it doesn't really seem to bother them that much, okay? So there is a genetic component to this as well. The signs and symptoms of this are pretty similar to the signs and symptoms of just regular pulmonary edema. The first one in this case, though, would be a headache. The patient might report a headache, and this is very common. If you have ever been somewhere that is a high altitude, maybe you've gone to like Colorado and you don't live there normally, you're not used to it, a lot of times people will report a headache. That's pretty common. So that's usually the first symptom. Then it goes into a cough. It starts off as a dry cough. And then it becomes that like classic cough we were talking about with the pink, blood tinged like frothy sputum. So a dry cough can turn into that. They of course will also experience tachycardia. They might report generalized weakness and chest pain. So this is just like a little bit special, a little bit different, and I wanted to make sure I talked about it in this video because, it is one of those things that does happen. So I just wanted to talk about it and make sure that we were all aware there is something called high altitude pulmonary edema. So a little bit different. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.